Those terms are important when you're looking at MRIs and CT scans, because that's the terminology that they will use on their reports. They'll say that it's a transverse view or a sagittal view. So then you can see what you're looking at. And what they'll do on those CT scans or MRIs give you multiple views, so you'll be able to zoom in and zoom out of that person's body from that view. So it might be from the side where you kind of scroll through the images as it kind of cuts through the body. Has anybody heard about an anatomy show where they plastinate the bodies? They inject plastic into them to preserve them. There's a guy, I can't remember what cut it was, but it might have been a sagittal cut, where he basically plastinated it, put them into like a resin, and then used saws to slice down the body in a sagittal view, and then split everything apart. Okay, and then you can walk in and out of each of those cuts, and you can see each bit of the body. Yeah.
Dr. Death.
Yeah.
I don't know his name.
Von Hagen's. Yeah, it's brilliant, really, really good. If you get a chance to go, it's amazing. Okay. It also links into this. Now, what I'd like you to do is have a think about those, have a look at those words, and think about what they mean, what movements might occur with those. Okay, so I'm not going to tell you, we'll just see what you think first of all, and then we'll see what you come up with. So in your teams again, in your little groups, have a think, what do these mean? We'll see if you got them right then. So flexion, if you remember the anatomical position, flexion is where you decrease the angle of a joint. So that is flexion. So from the anatomical position, so that would be elbow flexion. So shoulder flexion would be that. Okay. Now, as a general rule, kind of it nearly works for everything. Flexion means forward. So that's flexion, that's flexion, that's flexion, that's flexion. The only thing where it isn't is with the knee, where that's flexion, which is really annoying, because then otherwise everything would be the same. But forward is generally flexion. It's a decrease in an angle of a joint. So then extension is the opposite. So from a flexed position, you would then extend the elbow. Okay, my knees at the moment are already extended. So if they were flexed, and then I move them that way, that would be extension. Yeah, extension of the hip is that way. Okay, so extension is an increase of the angle of a joint. Flexion is a decrease. Abduction, if someone gets abducted, what happens? They get taken away. Okay, so taken away from the midline of the body, that's abduction. And that's the best way to remember that one. So adduction, adduction, is where you go from an abducted position and bring the arm in, so towards the midline of the body. So remember when we were saying about the anatomical position earlier in the midline and how important those positions are? This is why, okay, because everything comes from that anatomical zero position. Medial and lateral rotation. So medial is towards the midline, lateral is away. Okay, so you've got medial rotation here, lateral rotation here. You've got with the knees, so with the knee bent, medial, lateral rotation. You can't do that when the knee's straight because the ligaments stop it. So when the knee's bent, you can rotate your knee in and out, which is really important when you're walking. Okay, because as you take a step, your knee can adjust to whatever you're stepping on, and you can push off. Plantar flexion and dorsiflexion. Right, do you remember what plantar related to? The sole of the foot. Yeah, good. Okay, so plantar flexion is to do with movement of the ankle. So plantar flexion is where you point your toes, and dorsiflexion is where you bring it up. Remember, it's the dorsum of the foot. Yeah, so dorsiflexion, bringing the toes in. Plantar flexion, pointing the toes away. Pronation and supination, you can get this in a couple of areas, but mainly in the elbow and wrist. Okay, because of the structure of the radius and ulna in the forearm, the bones can spin across each other. The best thing to remember, if you remember one, then you'll remember the other. But supination, if you put your hands like that, and then you turn them up, bowl of soup. So supination is that way. Yeah, pronation is then just the opposite. So supination, bulbar sleep. Now, pronation and supination can also happen in the feet. Have you heard of that? Someone having a pronated foot? Yeah, flat feet. If you think about that, in fact, you can stand up for me. You can have a go at this. So arms like this, and you've got to just mimic the position of your feet with the position of your arms. So if you start with your hands like that, and then if you roll out onto the outsides of your feet, okay, yeah, that's supinated feet and supinated forearms. And then if you roll the hands in and roll your feet in, that's a pronated foot, so a flat foot, and a pronated forearm.